Hello, this is Carecraft's Project Fremont's third research report video. I am Aditya Ramesh, and today's topic is on Epstein-Barr virus, or EBV for short. Also known as human herpesvirus 4, EBV is a double-stranded DNA virus known to be one of the most common viruses, and most people have been infected with it at least once in their lifetime. This is often in their childhood. Fortunately, children with EBV usually don't experience any symptoms. EBV spreads primarily through saliva and other bodily fluids, which is why some people call it the kissing disease. While most infections have mild symptoms, EBV can cause infectious mononucleosis, aka mono. EBV was first identified in 1964 by Sir Anthony Epstein and Dr. Yvonne Barr. In this video, we will dive deeper into how EBV spreads, its symptoms, ways to combat it, and what it could mean for you or your loved one's health.
Epstein-Barr is known for having many common symptoms including fatigue and swollen lymph nodes. This often causes it to be confused with other viruses and diseases, particularly those in the herpesvirus family. Some other prevalent symptoms experienced are headaches, fevers, and sore throats. To help narrow a diagnosis, doctors look for lymphadenopathy or the enlargement of lymph nodes in the neck, splenomegaly, enlargement of the spleen, pharyngitis or inflammation of the pharynx, and lymphocytitis, also known as an increased white blood cell count. During a liver function test, individuals with EBV may also be found with liver abnormalities. However, these are just the physical manifestations of Epstein-Barr virus. Research has shown that EBV has psychological effects on top of its many other symptoms. It has been linked to depression, mood fluctuations, and heightened stress levels. Experiencing sleep disturbances and cognitive difficulties is also common. Additionally, studies have indicated a strong connection between EBV and schizophrenia. People with the genetic risk of schizophrenia produce higher levels of antibodies, which are proteins the immune system makes to fight infections. However, more research is needed to illustrate further how this viral infection influences and impacts mental health.
Moving on to the cause and effects, Epstein-Barr virus is a highly contagious disease as it spreads through the body's fluids, mostly through saliva. This disease is mostly contracted through sharing food or sharing other bodily fluids, as the disease spreads extremely quickly through all of the body's fluids. Any type of close contact can lead to the spread of this disease, like talking too close to a person, as even a small piece of saliva can make someone contract the disease and become infected as well.
At first, the patient may experience fevers, lymphadenopathy, splenomegaly, EBV hepatitis, or pancytopenia. Lung diseases and a higher risk of cancer, as well as heart swelling, are all effects of the condition.
If untreated, symptoms will worsen as the patient will start to develop progressive immunodeficiency and will succumb to opportunistic infections, hemophagocytosis, multi-organ failure, or EBV-positive lymphomas. This disease is also known to be very sporadic, as the disease can sometimes hibernate in your body and can cause no symptoms for some time. But then, the virus will wake up again and cause the signs to occur once again. This could cause troublesome conditions as someone must be tested after symptoms do not occur to ensure that the virus is gone.
There is currently no cure for the Epstein-Barr virus, so treatment focuses on managing symptoms. Hydration is crucial. Drinking plenty of fluids such as water, herbal teas, and electrolyte drinks help maintain hydration and supports the body in coping with the infection. Dehydration can worsen symptoms, so it's important to stay well hydrated. Rest is equally important. Adequate sleep and relaxation allows the body to heal. Overexertion can make symptoms worse, so it's essential to listen to your body and prioritize rest during recovery. For symptom relief, over-the-counter medicines like acetaminophen and ibuprofen can help reduce fever and alleviate pain. However, it's important to consult a healthcare provider before using these medications to ensure their proper use and safety. A key point to remember is that antibiotics, which treat bacterial infections, do not affect EBV as it is a viral infection. The distinction is important for managing treatment efficiently. After the initial infection, the Epstein-Barr virus remains dormant in the body but can reactivate under certain conditions, especially if the immune system is weakened. Most people recover from the initial infection within 2 to 4 weeks with appropriate symptom management. However, recurrent symptoms may occur if the virus reactivates in the future.
EBV is one of the most common diseases, with almost 95% of all adults in the United States having been infected by it. Its ability to cause lifelong infection and its strong association with other diseases highlight the need for early detection and intervention. Despite advancements in research, there is no cure. Fortunately, organizations such as the Epstein-Barr Virus Association and the National Institute of Allergy and Infectious Diseases play an important role in funding research, raising public awareness, and providing resources for people who may be affected. By supporting these efforts and prioritizing research, we can move closer to mitigating the impact of EBV, improving public health, and eventually finding a cure for the virus.